Ma'am, we are good words.
Good, good, good. Okay, so I'm sorry about the delay. So let's start our CU event. Can you guys tell me a little bit about who is doing what over here? Like, I know some people are doing IBA, some people are doing IBT. Can you guys tell me a little bit?
Yes, ma'am, I'm doing IBT.
Okay. And who else?
Assalamualaikum, ma'am. Yes, I'm also doing my IBT.
IBT? Okay. All right. Who's doing IBA? Okay. All right. So guys, we're going to start over here. And the first thing that we're going to do is you guys have taken your classes, right, for IBT? All your classes are done. And you have also done your, you're doing your supervision hours? So I think the last thing
Yes,
that
ma'am.
is left is your CEU events, right? So for CEU, the first one that we're going to do today is sleeping disorders in kids with autism. And for that purpose, I have an article over here that we are going to discuss. The article that I have is called as, this is an article that I got from the Sleep Disorders Journal of Pediatric Neuroscience. I can share this with you later also, and it is all based on autism spectrum disorder and sleep disturbances. So I will share this with you after we are done with this, CU event today. And then the first thing that I would like for you guys to do is watch a little video. And after that video, I'm going to go over this article. And this is a very, very detailed article because it talks about everything, that what are neurodevelopmental disorders, how much is the prevalence of sleep disorders in autism. It also talks about etiology of sleep problems, and then how can we change it, like sleep architecture, the clinical relevance. It talks about impact of sleep disturbances in children and how it affects families. How can we assess these sleep disturbances? And then how to establish positive sleep patterns for young children with autism spectrum disorders. How can we do environmental variables, bedtime routines, and sleep training for the kids? And then at the end, they talk about role of pharmacology and the role of medication. So the first thing that we're going to do is we're going to watch this little video. So give me 1 second. And then after that, I will finish up we'll go into the detail of this article. Can you guys see the screen?
Yes, ma'am.
Yes, ma'am.
One of the things that really struck me, Dr. Tarbox, was people talking about sleep issues.
Absolutely.
And they were talking about it from both perspectives, parents having sleep issues because of some of the stress that they've gone through, and the fact that if the child can't sleep, then automatically you have two people who can't sleep, right?
That's right, yeah. Absolutely.
So I thought maybe we could start with you talking a little bit about sleep issues and research that there may be and what you
Sure.
know about that.
Sure, absolutely. Well, first I'll start off by saying it's not necessarily my major area of expertise, but I have done a little bit of research and a little bit of treatment in the area, and I'm fairly familiar with literature. And it is, first of all, it is very common among kids with ASDs, which I don't need to tell your listeners that, they know that. Very, very common, though, among these kids to have challenges with sleep. And like you say, it really does impact the whole family. Everyone kind of knows, everyone expects this when you have a new baby, right? That the first few months or the first first year, you're going to be somewhat sleep deprived. It's going to make you feel kind of crazy. It's going to make you feel exhausted. It's going to be a major challenge, but not everybody knows that those challenges can continue, especially if you have a child on the spectrum.
Yeah.
And so really, I mean, we hear reports of, you know, families literally just falling apart due to total sleep deprivation for the whole family.
Yeah.
And there's good research that shows that if you don't get enough sleep, it disrupts every major system. You know, it makes, you know, increases depression, anxiety, exhaustion, causes problems for things that even like weight loss, memory, learning. I mean, you name it.
Yeah.
Sleep is just a core critical function that your body needs, period. So luckily, there are some good treatments that do actually work. Unfortunately, the vast majority of people in the autism community aren't aware of them, which, you know, how often do we say that?
Okay.
And unfortunately, most in the medical community are not aware of sleep treatments that actually work. And so what we usually hear from kids and families that we work with is they've gone to all their major medical doctors, you know, who are specialists in sleep. They do all sorts of assessments, EEG tests, everything you can think of. And still at the end of the day, basically say, well, yeah, your child has difficulty sleeping.
Wow.
Right, which can be incredibly frustrating and frankly, just not very practical. So one way to go is medication. Of course, that's what medical doctors do, is they prescribe medication. That's their job. Some medications may be helpful for some kids. However, like anything else, when we're talking autism, the first line treatment should always be less intrusive, right? And so anytime you're talking medications, you're talking about potential side effects. There aren't any medications that don't have at least some potential side effects.
Okay.
So best to always try behavioral and educational interventions first, because generally speaking, they have a much lower risk of side effects. So there are a number of behavioral procedures that do work, and happily, it actually does kind of come down to good old-fashioned ABA common sense.
Okay.
Most sleep disorders come down to building up of habits among the family, among the parents and the children that contribute to disordered sleep or disturbed sleep. So put simply, if you let your kids sleep in your bed, they're going to continue to sleep in your bed. And that's not necessarily just the case with kids on the spectrum. That's with all kids, right? So plenty of typically developing kids end up sleeping in their parents' bed till way older than they really should be. And really, honestly, what it comes down to is the kid wants to do it. Oftentimes the parents want to do it because it feels good, right? Especially if you have a kid with a disability. You want to do everything you can to make them feel happy and make them feel comforted. And sleeping together does that, right? So that's one thing. If your issue is co-sleeping or the child continuing to sleep in your bed, is really what it comes down to is if you let them do it, they're going to do it, okay? Another issue is scheduling. And so a lot of kids on the spectrum, we don't know why, but a lot of the kids on the spectrum don't naturally want to go to sleep at a reasonable time and don't naturally want to sleep all night. And we don't know why. It could easily be some neurochemical thing going on, some kind of hormones that are too high or too low, or some kind of who knows what, right? So there probably is some biological basis for it. However, once you build it up as a habit, and so a child builds up sort of a habit or a history of being awake multiple times per night, or even being awake up all night and then napping during the day, then what that does is that sets you up physiologically to want to do the same thing the next night, right? Because if you sleep all day, you're not going to be tired at night.
Right.
So basically, there's a lot of details to it. It's not really this simple, but the most simple advice I can give is it does come down to setting up a good schedule, setting up clear expectations, and having clear rules that you follow through with.
Okay.
And so the one thing that honestly has been proven to work consistently is a clear bedtime and just following through. So if it's time to go to sleep at 9 p.m., then that's it. And your kid needs to stay in their bed, and they don't get to get out of bed, and they don't get to do anything else until the set time to wake up in the morning. So whether it's 9 p.m. to 7 a.m., whatever it is, you just stick to your guns. Now, some of your listeners might be thinking, oh, easy for you to say. You're not the one that has to stay up all night and do it, right? Well, I have been the one who stayed up all night and done it.
In fact, you have when you were talking about the sleep deprivation with a new baby, you have a relatively newer baby.
11-month-old baby.
Yes. So he's not just talking from someplace far, far away. He is familiar with the sleep deprivation.
Right. And it's not common to see this, but some ABA providers will actually go and spend the night at your house for a couple nights to fix this problem, to help you fix it. Because really, Really, it is just a matter of you being consistent with your rules and your sleep routine with your child. But it can be extremely emotionally difficult to do that.
Yes.
So if your child is crying and screaming and saying, I want to sleep with you, mommy, why can't I sleep in your bed? What are you doing to me? You don't love me.
Right.
Of course, the natural reaction is to want to take the child, hug them, put them in your bed, obviously, right?
Yeah.
That's only human. But what that teaches your child is, okay, you don't have to sleep in your own bed and you don't have to go to bed. You can stay awake with me. All you have to do is cry and scream and guilt trip me, right?
Right.
So it's funny, my wife actually is also a BCBA. She just did this for a family just a couple weeks ago. She and one of the other employees at her agency went and spent the night at a family's house. They did 2 or 3 nights in a row, actually, switching off between different staff members. And basically, the intervention was very simple. Set up a reasonable sleep schedule and don't allow the child to leave their bed. So if they get up out of bed, you just simply put them back in bed. It's not mean, it's not punitive, it's just disallowing the child from escaping from the bed.
Yeah, I imagine it really important that in that moment, the person who's doing it has to be well rested previous to this,
right?
Which is why having help and support to do it, because you want to have sort of a not, you said it's not punitive. So having a
it's not emotional,
physical reaction, a non-vocal reaction to putting them, you just literally like putting a loaf of bread in the bed with no emotion whatsoever.
That's exactly right. No struggle. Yeah, it can't be an argument. It can't be a struggle. And let me say, too, that you front load this whole process with lots of positive stuff. So before you put your kid to bed the first time, you read a story, their favorite story, you have their favorite food for dinner, whatever it is, lots of snuggling, everything happy, positive. Decorate the room with all their favorite stuff. You know, if they're not used to sleeping in their room, then you get all their favorite posters, teddy bears, whatever. Everything positive you can think of. Maybe even there's stories you can get to read your child about, you know, Jimmy learning to sleep in his bed, you know, by himself. These types of things. Do all that good, happy, positive stuff first. And so what you're doing is you're setting your kid up for success. And then, quite honestly, though, they are going to cry and they are going to be upset. If they're used to sleeping in your bed and not having to go to bed every night for the last 5 years or 8 years or 10 years, they're going to expect that. And just like when you do extinction for any other challenging behavior, when you first do extinction, which just means not rewarding the behavior, right? And when the child's used to that behavior getting rewarded, they're gonna have what's called an extinction burst, which means they're gonna try harder.
Right.
So if they normally would do a little guilt trip to get you to sleep in their bed, now they're gonna do a really big guilt trip.
Right.
Okay.
Because they have to work harder to get what they wanted. I know, and if I do, I'm going to get what I want. So.
Exactly. And I'll tell you what, if you give in then, you've just taught them, no problem. You don't have to sleep in your own bed. Just try harder.
Yeah. Okay. We've got a question that's come in about something else. I just wanted to check and see if it was about this. If you see me squirming a little bit, it's because I'm hearing all these things and going, oh, guilty as charged.
We've all done it, you know, and again, it doesn't matter if your kid's on the spectrum or not. We've all done it.
Right. Kids. Okay. All right, but I think key and what you just said that really rang a bell with me is not having an expectation that we necessarily can do this by ourselves with what we currently have.
Right.
That maybe you have to ask your ABA provider. If you don't have that, maybe you have to ask a friend to say, hey, can you come over and do this for me during the day so I can sleep all day so that I'm prepped to be able to do this.
That's right.
You know,
or family members, you know, aunts, uncles, cousins, whoever. If you can get them, you know, on the same page with you, and if they're going to follow through, you know, and be a team player with you, absolutely, any support you can get. But the main thing is, and this is true with any time you're going to do extinction, the main thing is don't do it if you're not going to follow through. So you need to have a real honest conversation with yourself beforehand and ask yourself, am I really going to be able to do this? Am I really going to be able to follow through? And to what extent, you know, how far is my child going to push it? And can I follow through up to that level?
Right.
And if I'm not sure, don't even do it. Because you will make the problem worse. Wait until you have more resources, until you have a better plan, until you have more support, whatever it is. But just don't do it if you can't follow through.
Great.
Okay. So basically what they're saying is that you have to be very consistent with those sleep patterns and don't even try to do it if you are not ready to do that extinction procedure, right? So now let's talk about this article. What the article says is that autism spectrum disorder is a neurodevelopmental disorder. It is characterized by persistent impairments in, reciprocal, in social interaction and communication. Sleep problems are a very, very prominent feature that have an impact on social interaction, day-to-day life, on academic achievement, and have been correlated with increased maternal stress and parental sleep disruption. So basically what they're trying to say is that when a child is not going to be able to sleep, they are not going to be good for therapy. They are not going to be good for, anything during the daytime, school or academics. And it also causes a lot of maternal and paternal stress. And it also stresses out the relationship between the two. So, Polysomnography studies, which is a study that is done to see the sleep patterns of a child, which include studies of ASD children, showed most of their abnormalities related to rapid eye movement, which is the REM sleep pattern. So mostly the problem is happening at the REM stage, which is the rapid eye movement stage, which included decreased quantity, increased undifferentiated sleep, immature organization of eye movements into discrete bursts, decreased time in bed, total sleep time, REM sleep latency, and increased proportion of stage 1 sleep. So basically what they're trying to say over here is that when polysomnography was done, and this is a test that is supposed to be done for all children and all kids who are going through sleep problem and sleep disturbances, to rule out that why is a child having all of these sleep problems, right? Because first of all, you have to look at their physical issues, that why is the child having these before you put them on on a routine or you give them medication. You have to see that what is going on with them physically. So when the research was done and polysomnography was done, what was seen was that it is in the REM sleep pattern that there is decreased quantity of sleep. There is the eye movement is very immature at that time. And there is decreased time in bed with that, and total sleep time, latency, and increased proportion of stage during sleep 1. So the first phase is not completed, and that's why the child doesn't ever go into deep sleep. Implementation of nonpharmacotherapeutic measures such as bedtime routines and sleep-wise approach is mainstay of behavioral management. So when you're doing behavior management, the things that you're using is therapeutic intervention, which is something that they talked about in this video. They talked about how to manage the behaviors of the child, how to behaviorally improve the child. They also talked about, if we talk about pharmacology, or if we talk about medication, then there is, and we'll talk about it towards the end, that's the last thing that you should be doing. But even if you're doing all of the above, which is medicine and a sleep pattern, if the child is not able to have good REM sleep, that first thing, the first stage of sleep, the child is still going to wake up disturbed, and he's still going to continue with the same patterns. So basically, treatment strategies along with limited regulated pharmacotherapy can improve the quality of life in ASD and have a beneficial impact on family. So what they're trying to say is that if we use medicine as well as therapy, and we also do like pharmacotherapy, which is, with medication, we can improve the sleeping patterns of the kids with autism spectrum disorder. When we look at the literature from 1995 to 2015, we see that autism has increased. Autism is not going down. Autism is on the rise. So when we look at that, we are going to see that the neurodevelopmental disorders with a heterogeneous spectrum of clinical symptomology related to social interaction and communication is increasing. So all the disorders that have autism, which have the same common factors, that is neurodevelopmental disorder, lack of social interaction and communication, they are on the rise, right? So autism spectrum disorder is characterized by persistent impairment in all the above. And these children, they come with co-occurring behavioral issues. One of the behavioral issues is also the sleep patterns. Now, ASD disorder can be present with varying severity. So we know that autism has a lot of different, severity levels. The Center for Disease Control and Prevention, which is the, in 2008 indicated that the prevalence of autism spectrum disorder is 1 in 88 children. Okay. This was in 2008. According to the Autism and Developmental Disability Monitoring Newark, in 2000, the prevalence of autism spectrum disorder was 1 in 150 children, and this was in 2000. In 2008, it was 1 in 88 children. And in 2010, it became 1 in 68 children. And do you know that according to the CDC, last year, the consensus was 1 in 35 kids are being diagnosed with autism spectrum disorder. Children and adolescents with autism spectrum disorder suffer from sleep problems, particularly insomnia, and a higher rate, which typically developing kids don't have. And therefore, this ranges between 40 to 80% in kids with autism spectrum disorder. Therefore, we have to be very careful. We have to make sure that we are following the right path to get their sleep patterns under control. Because if we are not going to do it, as they grow older, these patterns are going to get worse and worse. More stress on the marriage, more stress on the kid, more stress on the mother and the father. A study based on parental reports showed that 53% of children 2 to 5 years of age with ASD suffered from a sleep problem. 56 out of 89 children with ASD had sleep disorders. Now, this is just the history that I'm giving you. So, we also saw that 86% of the children, the data that they took, they were suffering from sleep problems. The spectrum of sleep disturbances included 54% bedtime resistance problems. So 54% was behavioral problems, which were the problems that was talked about in the video, in which you are going to work with them behaviorally. Bedtime resistance, which is called as 56% had insomnia. So even though you're following a good bedtime hygiene, a bedtime routine, kids are still not sleeping. They just can't sleep, right? 53% had parasomnia, 25% sleep disordered breathing problems, 45% morning arising problems, 31% daytime sleepiness, which means that they sleep during the day. Hence, there is a lot of evidence to show that sleep disturbances is very common in kids with autism spectrum disorder. Now, let's talk about it a little bit. What is the etiology of sleep? Like, what does sleep look like? Etiology of sleep disorders in ASD is multifactorial with genetic, environmental, immunological, and neurological factors thought to play a role in development of ASD. There is evidence that there is association between sleep and melatonin rhythms with alterations in this synchronization of the melatonin rhythm causing sleep problems. So now, sleep rhythms and melatonin, they go in together with each other. So if the melatonin level is going to be messed up, the child is not going to be able to sleep, okay? Neurotransmitters such as serotonin is very important for your brain, GABA, pantene, we call that, there's a supplement called as GABA pantene. GABA and melatonin are required for establishing a regular sleep-wake cycle. So what I have also researched and seen that a lot of psychiatrists, psychologists, they are giving GABA, they are giving melatonin, and they are giving serotonin, which is an antidepressant, so that the kids are able to sleep, because that serotonin is extremely important for the sleep patterns. Serotonin, GABA, and melatonin. So these are the things that are naturally made in the brain. But somehow, if these are not being made, that's when the disturbance happens, the insomnia happens, the kids are not able to sleep. So this is why we have to look into the etiology. That's why if a child is having a sleep problem with autism, first we are going to rule out the medical, and then we are going to go towards the other side. Any impairment in production of these neurotransmitters may disrupt sleep. Melatonin is a hormone that helps maintaining and synchronizing the circadian rhythm. So we have a circadian rhythm with which we sleep. If melatonin is less, we're not going to be able to sleep, and it will not synchronize the circadian rhythm. Melatonin regulation may be abnormal in autism. So melatonin, again, kids with autism who have insomnia, there is an abnormality of GABA, serotonin, and melatonin. Clock genes may be involved in the modulation of melatonin and also in the integrity of synaptic transmission in ASD. So what we have to look at exogenous therapy of melatonin. And we have seen that kids that are given melatonin, they sleep well, they have better patterns of sleep. And then what else we have seen is that in melatonin synthesis, the final enzyme, it kind of goes together. The major sleep promoting area, that is the preoptic area in the hypothalamus, it uses GABA, right? And then a region of the genetic susceptibility has been identified on one of the chromosome, which is GABA related. Vitamin D is required for embryogenesis, neural development, and also for activating certain genes. Deficiency in vitamin during pregnancy could be an environmental risk for development of ASD also. Vitamin D, GABA, melatonin, and serotonin are extremely important. So this is the etiology, this is the physiological part that we talked about. Now let's talk about how we can help the kids. Now, one of the tests, which is polysomnography studies of ASD children, they have showed abnormalities that are related to the REM sleep, which is the first phase of the sleep. It includes decreased quantity, increased undifferentiated sleep, immature organization of eye movement, discrete bursts that they'll wake up and sleep and wake up and sleep, decreased time in bed, total sleep time, and sleep latency, and increased proportion of stage 1, which is REM sleep, that cycle in which they wake up and go back to sleep is a little bit more. So there are also great number of muscle twitches in those kids. 5 out of 11 children with ASD with disrupted sleep had nocturnal awakening. So they are going to wake up at night. REM sleep behavior disorders with lack of muscle atonia during REM sleep was also seen. There was a study that was done between children with autism in comparison to children that had tardive dyskinesia, which is another disability. It showed that autism kids had longer sleep onset latency, reduced sleep efficiency. So they take a longer time to sleep, and the efficiency is lesser. They wake up more faster, and then neither group demonstrated correlation between sleep stage percentage and cognitive tests. So, this didn't show any correlation between, cognitive testing and sleep testing. So children with autism spectrum disorder have more disturbed sleep according to the structure. So basically, when, affective problems improve with with increased sleep, particularly REM and slow wave sleep patterns, kids that were, diagnosed with autism spectrum disorder, they are the ones who are showing more of these issues. Now let's talk about the impact. The impact of sleep disturbances on children with autism spectrum disorder is on the caregivers. So whoever is taking care of the kids, it burns them out, because how many times you have to wake up at night, you have to take care of the kids, then you try to fall back asleep, you can't fall back asleep, and then the parents, sometimes they have to go to work, they are burnt out, they are fighting with each other. So this is a huge toll on the parents. So therefore, it is extremely important that this problem is addressed to in a behavioral manner, in a pharmacological manner, as well as the environment has to be modified, right? So let's talk about assessment. How can we do an assessment of sleep problems in autism spectrum disorders? An early and routine assessment of sleep in children with autism is very important, and it helps the parents also. Sleep may be assessing utilizing subjective or objective measures. So what are subjective measures? Subjective measures are going to be questionnaires. You can take some questionnaires. They are available online also. And you can ask the parents, you can ask the caregivers, and you can say, hey, how much time does the child sleep? And you can even go online and you can find some great questionnaires. And you can also have sleep diaries. So you can ask the parents to write sleep diaries of what time did the child go to sleep, what time did he wake up, what time did did he go back and up, or just have those sleep diaries done. These are subjective measures. Objective measures would include actigraphy and PSG for assessing the sleep disorder. And PSG is what we talked about before, which was the polysomnography studies, and this is only done by a neurologist. And these studies, they should be done in order to see the awake and the sleep patterns of the kids. And this is a device that they wear on the wrist and record movements that can be used to estimate sleep parameters with specialized logarithms in the computer software. Okay. So and then their psychological assessments can also be done in detail. History from the parents can be taken, teachers can be taken, and caregivers can be taken that describe the child's current problem. The sleep history should include predisposing factors, that is, developmental vulnerabilities, precipitating factors, onset of medical condition or medications, poor sleeping hygiene, precipitating factors, napping during the day, co-sleeping with the parents if they are sleeping in the same bed with the parents, maintaining a sleep log. So there should be a sleep log. What time did he sleep? What time did he wake up? You can easily make those logs by yourself, or you can find them online. There are a lot of free resources that you can find. Maintaining a sleep log or sleep diary could help determine factors that might be resulting in poor sleep. You also need to establish positive sleep patterns for young children with autism spectrum disorder. How can you do that? Children with autism spectrum disorder may experience various sleep complaints such as difficulty falling asleep, analysis of frequent awakening during the night, or reduced sleep. Ongoing and persistent sleep disturbances can have an adverse effect on the child, parents, and other household members. So what you need to do is that you need to reinforce a positive sleep pattern for the child, following helpful strategies. What are helpful strategies? Assessment of any underlying medical problems such as tonsillitis, adenoids, gastrointestinal disturbances, and seizure. They may affect sleep. Now, what we have seen is that there are a lot of kids that have GERD problems, stomach problems, gas problems, right? And they all arise from giving milk to the kids at night. So I have seen kids who are 3 years old, 4 years old, 5 years old, and they are all drinking from a bottle. Now that bottle is a big enemy for our kids who have sleep disturbance. So any kid, they should be weaned off of a bottle. The sucking of the bottle, it takes a lot of air into the child. It's not good for their mouth also. And also, if you guys have read psychology, according to the psychologists, it's not good for the child because it doesn't let them get out of a certain phase and go into a next phase of their life, right? So the child might have many problems. They could have health problems. They could have gastric problems and tonsillitis and adenoids. They have problems sleeping, anything like that. So you have to first look into all the medical problems. You have to look at their bedtime routine, that when you are trying to put them to bed, are there any disturbances around them? Can they sleep properly? Is there noise? Sometimes, what happens is that if we have kids and, we have a lot of guests in the house, or if we have other people that are staying with us in the house, or you are up waiting for your husband because your husband's working late, you can always try to take your child to sleep in their room, in their bed. And, you can have the room dark. You can give them a nice shower, a nice bath. They can be in bed, and you can close the windows, the blinds or the curtains, and you can have a small nightlight on, give them their, their teddy bear, whatever they like, give them a kiss, give them a hug. And then after that, put on some white noise. The white noise sometimes helps a lot. Now, if you guys don't know what white noise is like when you go to a clinical psychologist's office and they put on that sound that comes out of like this white noise machine, or even on your phone, you can go to YouTube and find white noise. That white noise is going to barricade all the noise that is coming from outside in the room, and the child is going to be able to sleep with that white noise. Screening for intrinsic sleep disorders such as sleep apnea. So sleep apnea is also something which is of a lot of concern. Sleep apnea is when you have issues with the oxygen going into your lungs. So for that, there are some machines that are available for them. Also, you have to look for restless leg syndrome. Some kids have vitamin deficiencies, and they have like their legs are restless at night, so maybe they need some massage on their legs, maybe they are vitamin deficient, they need some vitamins. You have to look into that. Or periodic limb movement disorders. Some of our kids, they have limb disorders. So look at that. And you want to make sure the child is comfortable when they're going to sleep. They shouldn't have any pain. They shouldn't have any kind of issues. Assessment of food or environmental allergies that are commonly observed in ASD. You also want to make sure that you are observing the child and the environment and you're seeing that the child is not allergic to anything. So for example, milk, kids are allergic to casein. Wheat, kids are allergic to gluten. Pollen allergies, animal allergies. You have to look at everything, fungus, mold in the house. Look at everything. Make sure your child is not allergic to anything. So you have to look for assessment of the food and the environment to see that what are the commonly observed things that are creating allergy for the child. Assess the environmental variables that could affect the child's sleep, such as temperature of the room, bedding, sleeping clothes. You want to make sure they are in comfortable clothes. They have taken a shower before they go to sleep. They've had a nice calm bath. They have been oiled down. Things like that. Certain textures can relax or arouse your child. So make sure that you know that what are the sensory needs of your child, and you have used the calming structure, calming textures for your child so that your child has calmed down. Consider the noise level, visual stimuli in the room, and how they affect the child. So please make sure that they're not using the phone before they sleep or the iPad before they sleep, because this over here is the biggest problem. This is all scrolling. So it's all stereotypical behavior. So the kids are basically getting into a stereotypical behavior. And once your brain starts to work into that stereotypical behavior, then it gets more and more active and the children do not want to go to sleep. So keep the phones away from them, keep the TV away from them, keep the tablets away from them before they are going to sleep. Bedtime routines. Bedtime rituals are very, very important for most children. They help in establishing positive sleep patterns. Please make sure that your kids have a certain bedtime. Like if it is 7 o'clock, it has to be 7 o'clock every day. If it is 8 o'clock, it has to be 8 o'clock every day. Make sure that they are following those positive sleep patterns. Make a visual bedtime schedule and pick a specific time for bed that is reasonable. So make sure that you have a very, very specific time that is only for bedtime routine. And then make a visual bedtime schedule and pick a specific time for bed that is reasonable. Provide reminders and consistency for the whole family. So remember, when you are training a child, you're actually training their whole environment and their whole family. Consider noise levels, visual stimuli in the room, and how they affect the child. So you have to make sure that you are looking into the noise levels of the room. You're looking into the visual stimuli. You're looking into how it affects the child. So make sure that there is no noise in the room is calmer. I have a dog, well, I have cats also, but I have a dog also. My puppy doesn't sleep till she has a certain noise in the room. So, every child is different too. And, every organism is different. So you have to make sure that your child is actually comfortable. The noise is comfortable for them. The lighting is comfortable for them. Their clothing is comfortable for them. So bedtime rituals are really, really important. And then do a social story with them, like do a social story for bedtime routines with them, make a visual schedule for them, put it in their room, follow that bedtime schedule. I'm going to give you, like, you have cards, put the cards up like this, have a strip, and then make the child take off the card and put it on the side of what he did. Like, did he do his toothbrushing? Did he change his pajamas? Did he brush his teeth? Now he can go to bed. So do that. Sleep training. After the bedtime routine is done and the child is in their bed or crib but is upset and obviously not sleeping because they don't want to sleep. No kid wants to sleep. My grandson slept at 2 a.m. last night because there was holidays, there are fireworks over here, family is together, there's a parade going on. He didn't sleep till 2 o'clock, but that's not his routine but he didn't want to go to sleep because he was enjoying the fun. So kids want to enjoy the fun, but please keep them on their bedtime. After the bedtime routine is done and the child is in his bed or crib but is upset and obviously not sleeping, wait a few minutes and then go back into the child's room to check on him or her. Checking involves going back into the child's room and briefly, not more than a minute, touching, rubbing, or maybe giving a high five, thumbs up, or a hug for an older child who better responds to these gestures. Gently but firmly say, "It's okay, it's bedtime, you're okay," or a similar phrase, and then leave the room until it is time for the next check-in or until a child falls asleep. It is important to know that it is more likely that the child's behavior will get worse for a few days than it improves, because this is called as extinction burst, right? Because you're trying to put a behavior on extinction, you're putting their escape on extinction. So when you're putting their escape on extinction, their behavior is going to get worse. Now let's talk about the role of pharmacotherapy, which is medication. If a child does not respond to behavioral changes, then medications they may be considered, such as benzodiazepines and diphenhydramine. Given over-the-counter drugs were shown to have paradoxical and excitatory responses that have been reported. Then there's also the alpha-2 adrenergic agonist clonidine, but that reduces the time to sleep and also nighttime awakenings. So that's why clonidine should be, it should not be used. Now let's talk about the role of melatonin. Melatonin is another medication that can be used. Melatonin is a hormone that regulates the circadian rhythm. Melatonin appears to be effective in reducing time to sleep, but its efficacy in reducing nighttime awakenings and other aspects of disturbances is variable, because you have to look at, your doctor has to prescribe the dose for you, which is going to be good enough for your child. Children with autism and neurological impairments present special challenges for drug administration. They may present with unusual feeding difficulties and restrictive diets. Parents often have to be extremely creative in disguising or mixing medication with the right type of liquid or food. Melatonin can be administered in toothpaste form also. So the conclusion over here is there's a high prevalence of sleep disturbances among children with ASD, many of which are unrecognized. Sleep disturbances have an adverse effect on their social interaction, academic achievements, and well-being of the caregivers. Implementation of pharmacotherapeutic measures such as bedtime routines and sleep-wise approach are the mainstay of management. These treatment strategies with limited regulated pharmacotherapy can help improve the quality of life for children with ASD and also for the parents. So basically what they're saying is that first you have to, assess the child. You have to do objective assessments, subjective assessments. You should also do medical examinations. Then you should do behavioral changes, and you should also go for medication towards the end. But sleep patterns, they have to be improved earlier on in life. You shouldn't wait for a very long time. Okay? Does it make sense, guys?
Yes, ma'am.
Okay, any questions,
Yes,
concerns,
ma'am.
any comments? I will share the recording with you, and I will share the article with you. All right, and I will see you guys tomorrow. I will try to see you guys a little bit earlier tomorrow. I will message you. All right. See you
All
guys.
right, ma'am.
Bye-bye.
Thank you so much.
Welcome. Bye.